We now come to the statement. Prime Minister.
Thank you, Mr. Speaker. With permission, I will make a statement on the government's plans for health and social care. Our National Health Service is the pride of our whole United Kingdom, and all the more so after it has been there for us during the worst pandemic in a century, treating almost 500,000 patients, administering more than 88 million vaccines and saving countless lives. But the inevitable consequence of this necessary and extraordinary action is that COVID has placed massive pressures on our NHS. As we stayed at home to protect the NHS, thousands of people did not come forward for the treatment they needed. Like those who suffer from COVID, these are all people we know. Your aunt, who needs a new hip. Your neighbour, who has problems with their heart and needs a pacemaker. Your friend at work, who thinks that they should get that lump or cough checked out. So we must now help the NHS to recover, to be able to provide this much-needed care to our constituents and the people we love, and we must provide the funding to do so now. We not only have to pay for the operations and treatments that people decided not to have during the pandemic, we need to pay good wages for the 50,000 nurses who will enable that treatment and who can help us tackle waiting lists that could otherwise expand to 13 million over the next few years. We need to now go beyond the record funding we have already provided, and we need to go further than the 48 hospitals and 50 million more GP appointments that are already in our plan. So today we are beginning the biggest catch-up programme in NHS history, tackling the COVID backlogs by increasing hospital capacity to 110% and enabling 9 million more appointments, scans and operations. As a result, while waiting lists will get worse before they get better, the NHS will aim to be treating around 30% more elective patients by 2024-2025 than before COVID. And we will also fix the long-term problems of health and social care, that the party opposite certainly failed to tackle, Mr. Speaker, and that have been so cruelly exposed by COVID. But having spent £407 billion or more to support lives and livelihoods throughout the pandemic, from furlough to vaccines, it would be wrong for me to say that we can pay for this recovery without taking the difficult but responsible decisions about how we finance it. As a permanent additional investment in health and social care, it would be irresponsible to meet the costs from higher borrowing and higher debt. From next April, we will create a new UK-wide 1.25% health and social care levy on earned income hypothecated in law to health and social care, with dividend rates increasing by the same amount. This will raise almost £36 billion over the next 3 years, with money from the levy going directly to health and social care across the whole of our United Kingdom. This won't be pay awards for middle management. It will go straight to the front line at a time when we need to get more out of our health and social care system than ever before. And it will enable radical innovation to improve the speed and quality of care, including better screening equipment to diagnose serious diseases such as cancer more quickly, designated surgical facilities so non-urgent patients are no longer competing with A&E, faster GP access to specialists so you don't have to wait months to see someone in hospital to find out whether something is wrong, and new digital technology so doctors can monitor patients remotely in their homes. And we will do all this in a way that is right and reasonable and fair. Mr. Speaker, some will ask why we don't increase income tax or capital gains tax instead. But income tax isn't paid by businesses, so the whole burden would fall on individuals, roughly doubling the amount that the basic taxpayer could expect to pay. And the total revenue, Mr. Speaker, from capital gains tax amounts to less than £9 billion this year. Instead, our new levy will share the cost between individuals and businesses, and everyone will contribute according to their means, including those above state pension age. So those who earn more will pay more. And because we are also increasing dividends tax rate, we will be asking better off business owners and investors to make a fair contribution too. In fact, the highest earning 14% will pay around half the revenues. No one earning less than £9,568 will pay a penny. And the majority of small businesses will be protected, with 40% of all businesses paying nothing at all. And while Scotland, Wales and Northern Ireland have their own system, we will direct money raised through the levy to their health and social care services. So in total, Scotland, Wales and Northern Ireland will benefit from an extra £2.2 billion a year, Mr. Speaker. And as this is about 15% more than they will contribute through the levy, it will create a union dividend worth £300 million, Mr. Speaker. Worth £300 million. But, Mr. Speaker, we can't just put more money in. We need reform and change. We need to build back better from COVID. When the COVID storm broke last year, there were 30,000 hospital beds in England occupied by people who could have been better cared for elsewhere and who wanted to be better cared elsewhere. That's 30,000, Mr. Speaker, out of 100,000 hospital beds in our NHS, costing billions every night and unable to be used by people needing cancer care, needing hip operations, making it harder than ever to deal with the growing backlog in our NHS. Too often, people were in hospital beds because they or their relatives were worried about the cost of care in a residential home. And that same fear kept many others at home without any care at all. This anxiety affects millions of people up and down the country. The fear that a condition like dementia, one of nature's bolts from the blue, could lead to the total liquidation of their assets, their lifetime savings, their home, the loss of everything that they might otherwise pass on to their children, however great or small. While sufferers from other diseases who have to be in hospital for the majority of their treatment have their care paid for in full by the NHS. Governments have ducked this problem for decades. Parliament even voted to fix it. And yet that 30,000 figure is an indictment of the failure to do so. And so, Mr. Speaker, there can be no more dither and delay. We know we can't rely solely on private insurance because demand would be too low for insurers to offer an affordable price. And a universal system of free care for all would be needlessly expensive when those who can afford to contribute to their care should do so. Instead, the state should target its help at protecting people against the catastrophic fear of losing everything to pay for the cost of their care. And that is what this government will do. We are setting a limit on what people can be asked to pay. And we will be working with the financial services industry to innovate and help people to insure themselves against expenditure up to that limit. Wherever you live, whatever your age, your income or your condition, from October 2023, no one starting care will pay more than £86,000 over their lifetime, and no one with assets less than £20,000 will have to make any contribution from their savings or housing wealth. That's up from £14,000 today. Meanwhile, anyone with assets between £20,000 and £100,000 will be eligible for some means-tested support. And this new upper capital limit of £100,000 is more than 4 times the current limit, helping many more people with modest assets. And as we fix this long-term, long-standing problem in social care, we will also address the fears that many have about how their loved ones will be looked after, by investing in the quality of care, in carers themselves, and by integrating health and care in England. So older people and disabled people are cared for better, with dignity and in the right setting. My right honourable friend, the Secretary of State for Health and Social Care, will be bringing forward a white paper on integration later this year. Mr. Speaker, you can't fix the COVID backlogs without giving the NHS the money it needs. And you can't fix the NHS without fixing social care. You can't fix social care without removing the fear of losing everything to pay for social care. And you can't fix health and social care without long-term reform. The plan that this government is setting out today, the plan I'm setting out today, will fix all of those problems together. And of course, no Conservative government, Mr. Speaker, ever wants to raise taxes. And I will be honest with the House, I accept that this breaks a manifesto commitment, which is not something I do lightly, but a global pandemic was in no one's manifesto, Mr. Speaker. And I think the people of this country understand that in their bones, and they can see the enormous steps this government and the Treasury have taken. And after all the extraordinary actions that have been taken to protect lives and livelihoods over the last 18 months, this is the right, the reasonable and the fair approach, enabling our amazing NHS to come back strongly from the crisis, tackling the COVID backlogs, funding our nurses, making sure people get the care and treatment they need in the right place at the right time, and ending a chronic and unfair anxiety for millions of people and their families up and down this country. And I commend this statement to the House.
I now call the Leader of the Opposition, KEIR STARMER.
Thank you, Mr. Speaker, and can I thank the Prime Minister for advance sight of his statement. I think I had almost as much notice as the Cabinet. Can I also thank everybody who works in the NHS and social care. Mr. Speaker, during the darkest days of the pandemic, they kept our health service from collapsing, they looked after the elderly when others couldn't, and they rolled out the vaccine, which has finally provided the light at the end of the tunnel. Despite their efforts, we're facing the toughest winter in the history of our health service. Not only do we have the threat of another COVID surge, waiting lists for diagnosis and treatment have reached record levels, we risk cancer survival rates going backwards for the first time ever, and social care remains neglected and strained. It is a crisis. But how did we get here, Mr. Speaker? The pandemic has undoubtedly placed the NHS under huge strain, but that is only part of the story. A decade of conservative neglect weakened the NHS. Waiting lists had spiralled up 2 million before the pandemic. Targets were missed on cancer, on A&E, on mental health before the pandemic. The same is true, Mr. Speaker, on social care. £8 billion cut despite growing demand before the pandemic. Carers on poverty wages without secure contracts before the pandemic. 100,000 vacancies before the pandemic. And the Prime Minister has just referenced the 30,000 hospital beds occupied by those that should go into the community. And he called that, this is before the pandemic, an indictment of failure. Who had been in government for 10 years at that stage? Just remind me. An indictment, Prime Minister, an indictment of failure is an accurate description of the situation in our health service and social care before the pandemic. So the pretence that the Prime Minister is only here because of the pandemic is not going to wash. He's putting a sticking plaster over gaping wounds which his party inflicted. He made that commitment on social care before the pandemic, and he said he would pay for it without raising taxes before the pandemic. Yes, Mr. Speaker, the NHS urgently needs more investment. But the backlog will not be cleared unless the government hits the 18-week target set out in the NHS Constitution. The Prime Minister didn't mention that. It was set and it was met by the last Labour government. So if there's to be improvements, Prime Minister, a direct question: can the Prime Minister commit today to hitting the target and clearing the backlog by the end of this Parliament? Yes or no? I know he likes to avoid these questions, but if he can't answer that basic question, it's clear he hasn't got a plan. Turning to social care. Mr. Speaker, turning to social care. Under these proposals, people will still face substantial costs. And I heard what the Prime Minister says, so another direct question for him. Can the Prime Minister guarantee that under his plan, no one will have to sell their home to fund their own care? Yes or no? But social care, well, he just told us, let's hear him make that commitment at the dispatch box, that no one under his plan will have to sell their own home to fund their own care, and then we'll come back to it. But social care, Mr. Speaker, is about so much more than this. The blunt and uncomfortable truth is that under the Prime Minister's plans, the quality of care received will not improve. There's no plan for that. People will still go without the care that they need. There's no plan for that. Unpaid family carers will still be pushed to breaking point. There's no plan for that. Working-age adults with disabilities will have no more control under their lives. There's no plan for that. Pay and conditions will not improve for care workers. There's no plan for that. Let me spell that out. A poorly paired care worker will pay more tax for the care that they're providing without a penny more in their pay packet and without a secure contract. The Prime Minister shakes his head. My sister is a poorly paid care worker, Prime Minister, so I know this firsthand. This is a tax rise that breaks a promise that the Prime Minister made at the last election. A promise that they all made at the last election, every single one of them. A tax rise on young people, supermarket workers and nurses. A tax rise, Mr. Speaker, that means a landlord renting out dozens of properties won't pay a penny more, but the tenants working in full-time jobs would. A tax rise that places another burden on business just as they're trying to get back on their feet. Mr. Speaker, read my lips. The Tories can never again claim to be the party of low tax. The alternative, Mr. Speaker, is obvious. A timetable and plan to clear waiting lists, just as we did under the last Labour government. A comprehensive reform plan for social care, dealing with the inadequacies I've just pointed out, and driving up the equality of provision. And not just tinkering with the funding model. We do need to ask those with the broadest shoulders to pay more. And that does include asking much more of wealthier people, including income from stocks, from shares, from dividends and from property. Chancellor, I was listening. But fiddling, and the Chancellor knows the numbers just as well as I do, he'll have done the sums and we've done them, tinkering and fiddling with the dividend won't do that. Instead, the government is placing the primary burden on working people and businesses struggling to get by. As I've said to the Prime Minister, if the government comes forward with a plan to genuinely fix the crisis in social care and has a fair funding model, then we will work together. Thousands of families struggling with the current system, who only want the best for their loved ones, deserve nothing less. Thank you, Mr. Speaker.
Prime Minister.
Well, Mr. Speaker, I think we now we know why over decades the Labour government totally refused to deal with this problem. And now we know why both Blair and Brown failed to do it. The right honourable gentleman has absolutely no plan. I was waiting, Mr. Speaker. I'm amazed that he sat down. What is his answer to the backlogs in the NHS? And what is his answer to the problems in social care. They have absolutely no plan, Mr. Speaker. They have no idea how they would raise the money. Just to answer some of his questions, we of course will be investing in social care, and I thank his sister for what she's doing in social care. But we have lifted people's wages across the country with the living wage, Mr. Speaker, with record increases in the living wage. We're investing in 700 training places for people in social care, and making sure we invest 500 million. That's in the plan today. 500 million care in the social care workforce, Mr. Speaker. But what this is also doing is enabling us to get our wonderful NHS back on its feet and enable it to deal with the backlogs. And what he totally failed, Mr. Speaker, is to explain how the Labour government would do it. 1 year of capital gains tax would even begin to deal with this problem, Mr. Speaker. He has not got a solution, and I think it is deeply irresponsible of him to come to this place without having any kind of alternative. This is the government. Under them, let's be no doubt. If we did what we've heard from the Labour Party over the last few weeks, Mr. Speaker, we'd still be in lockdown, Mr. Speaker. We'd still be in lockdown because he opposed coming out of stage 4. We'd have absolutely nothing by way of dealing with the NHS backlogs. And after decades, Mr. Speaker, of inertia from the Labour Party, we'd have absolutely no way of dealing with the anxiety of millions of families across this country who face the prospect of catastrophic costs of social care. This government is dealing with those. We're dealing with all of them. We're getting on with it. We're taking the decisive action. We're doing it all together. This is the government that gets on and deals with the people's priorities. This is the government that tackles social care, and indeed, this is the party of the NHS.